Good evening, everyone. I'm very sorry about the delayed start. If this is your first time with us, my name's Dr. Edmund Farrer. I'm the founder of Otto. I'm an ex-military doctor and I have tinnitus myself. So we've got a really, really exciting webinar for you today, guys. So we've got Rachel Knappett with us. So this is a great opportunity because Rachel's one of the leading tinnitus specialist audiologists in the UK. So she's currently serving as head of adult rehabilitation at Cambridge University Hospitals. And she's got a lot of experience in tinnitus, which I'm sure we'll hear a bit more about, but specifically tinnitus and hearing and tinnitus and hearing aids. So we've got an opportunity to speak to one of the true experts in the field. And you're going to get an opportunity, guys, to ask your questions to Rachel later on. So if you have any questions for Rachel, please put them in the Q&A. So Rachel, the format we normally use is your audio working, by the way?
I can hear you. Can you hear me now?
Great. Yes, we can hear you. Yes. Good. So the format we normally used is we'll just have a discussion about the topic, which tonight is going to be the link between tinnitus and hearing loss, with some discussion about hearing aids as well. And then we go on to an audience Q&A. So everyone will have an opportunity to ask their questions directly to you on the chosen topic. So yeah, let's jump straight in. I mean, I hope my introduction was sufficient. Is there anything you wanted to add there?
No, that was a great introduction. I'm very flattered. Thank you.
Good. Well, look, it would be great if you could just start by, this is one of the really common questions we get with tinnitus. And a lot of people get confused about, because I found it quite confusing to beginning as well, actually. What's the relationship between tinnitus and hearing loss? How are they connected?
That's a good question. So I have prepared some slides, and it might be easier if can I share my screen and I'll talk through that? I'm trying to do that. I think you have to allow me to do it, Ed.
Okay. Yeah, so try that now.
Okay. You can see that?
Yes, we can. Yes.
Okay. So yeah, thank you for it was a lovely introduction, and I thought I'd talk a bit about sound therapy as well, just because sound therapy is probably, it's not the most exciting topic that I think people wouldn't be drawn to a talk about it, but I'm really passionate about it, and I think it doesn't always get the attention it deserves. And I just wanted to also say that often when people come to my clinic, these are the types of questions and statements that people say to me. So quite often people will say that they've tried sound therapy and that it hasn't really worked for them, or that it was just as irritating as their tinnitus. People will often be under the impression that they need a specific type of sound or something that's been tailored to their tinnitus. Often they're worried about using sound therapy at night because they think it's going to disturb their partner. And when it comes to hearing aids, I mean, quite often I think people come to the tinnitus clinic because they're bothered by tinnitus. They don't come seeking help for hearing. And even if we happen to discover that there's some mild hearing loss, if that hearing loss isn't troubling you too much, well, why would you want to do anything about it? So I think understanding that link between hearing loss and tinnitus is really important. So I've kind of jumped straight in then with some slides to look at kind of ear anatomy and to have a think about what's going on here and why people get tinnitus and why we often see it with hearing loss as well. So just a quick whiz through this. So you've got anatomy of the ear there. So sound is coming into the ear, causes the eardrum to vibrate. Behind that, you've got the little chain of bones. So the bones are rocking backwards and forwards and they are pushing on the inner ear. So that's comprised of your balance organ and then the cochlea for hearing. And the cochlea is the most fantastically intricate piece of kit. So the cochlea has fluid inside it. It's got 3 chambers of fluid, and it also has this membrane running through it, upon which there are thousands and thousands of cells. The important ones being the hair cells, which many of you will have read about and heard about. So they're so called because they've got these little structures on top of them that look like hairs. Now, what happens is that as the bones are pushing on the cochlea, the fluid inside it will move in a wave, and that causes the membrane to move, and in turn the hairs will also move. And that movement will cause the cell to fire a signal along the hearing nerve and up to the brain. And obviously it's up in your brain where you're decoding that information. You're working out what sound is and how to respond to it. Now, hearing loss, obviously there are lots of different types of hearing loss, but just to focus for a moment on sensory hearing loss, so the type of hearing loss that you might get perhaps with noise damage or with aging. The way that those cells are organised in the cochlea, on the first turn, you've got cells that pick up high pitches, high frequencies. And then as you go further into that coil of the cochlea, you find cells that pick up low pitched sounds, low frequency sounds. So high frequency cells they're the most vulnerable ones. They tend to get damaged most easily. Now, we'll come back to this in a second, but just to understand then a little bit about what your brain does with sound and what the tinnitus is. So we think that tinnitus is essentially like a background current on the hearing nerve. So your hearing nerve is carrying all of these important signals about sound, but it also carries this background current. And we think that possibly some of that is generated by those cells. So we think that the cells, they actually sometimes fire completely spontaneously. Now, our brain should be able to deal with that. This is what we call a neurophysiological model of tinnitus. And we can see here how, in this model, how our brain deals with sound. And the first thing that happens is our brain is supposed to be filtering everything that we hear. And so if you've got a little bit of background activity on the nerve of hearing, what should happen is that those filters should block it. But we get tinnitus when the filters fail to do that. When that happens, our brain perceives it as sound. It's activity on the nerve of hearing. So we hear something. And there are other areas of our brain that become involved as well. So the emotional part of your brain causes you to have thoughts and feelings about what you hear. And then you've got your autonomic nervous system, which will make automatic changes to your body in response. So it might cause an increase in your heart rate and your breathing rate. It might tighten your muscles a little bit. So because of that interaction with those other areas in your brain, it basically causes the tinnitus to persist. So those filters will remain wide open and when we keep noticing tinnitus. And we think that if you've got some cells in your cochlea that are damaged because you've got hearing loss, well, possibly it's more likely that you get a bit more spontaneous activity from those cells. But the other possibility is that, if you're not hearing quite so well, maybe those filters widen a little bit to try and allow a little bit more activity to pass through. And so again, we become more aware of tinnitus. Is that making sense so far?
Yes, definitely making sense for me. If anyone has any kind of questions or if anyone's confused about any of this, just please pop a message in the chat. But certainly, it's this is fascinating, by the way, Rachel. As I'm learning something new here.
I've whizzed through it, so I'm aware that I've gone through that very, very quickly, and we can absolutely talk about it and revisit it. But I thought maybe I would talk a little bit now about kind of sound therapy and hearing aids and how it all works. Is that okay, Ed?
Brilliant. Yeah, please. This is perfect. Yeah, this is probably a lot better than the questions I had prepared. So thank you.
Oh, okay.
Yeah.
Okay. So sound therapy. Let's talk about that first. So what do we actually mean by sound therapy? Well, what we mean is that we're essentially using an electronic device to produce sound for therapeutic use. And there are different ways to do that. So we might use what we call sound enrichment. So with that, we're just using a different sound to make the tinnitus less annoying and not so intrusive. And possibly that's something that helps to actually aid habituation, because if you are not feeling so annoyed by your tinnitus, if you're feeling a bit happier because you're listening to something else, you know, going back to that previous model that we were looking at, less negative thoughts about the tinnitus, less agitation, hopefully, ultimately, that's going to reduce your awareness. But there's also masking, and that actually means using sound to make your tinnitus less audible. And so you might try to completely mask your tinnitus, or you might partially mask it. I think one of the confusing things in the tinnitus world, the world I inhabit clinically, is that years ago, all devices that produced kind of a white noise were basically called maskers. But there is this difference in the way that we use sound. But there are many benefits. You know, it's not just about covering the tinnitus up, although masking it might be beneficial some of the time. You know, for some people, to get a bit of a break from your tinnitus at times might be really nice. It might provide quite a lot of relief. But sound enrichment, you know, obviously, as I've said, that might help you to, you know, not be feeling so worried or upset by your tinnitus. It might provide a welcome distraction. Some of those really nice relaxation sounds can make you feel more relaxed, so it can aid relaxation. There's also some evidence that actually, you know, using sound therapy does trigger some neuroplastic changes within your brain. So we've talked a bit about, you know, we've talked around that neurophysiological model, but the auditory pathway is incredibly complex, and there are different points along the pathway where, you know, sound or our awareness of sound is kind of switched on and switched off. And it's possible that if you're using sound therapy consistently for a while, that actually it really helps to change the way that your brain is processing sound, so it pays less attention to tinnitus. I think one of the questionnaires that we use when we assess people with tinnitus asks about, do you feel in control of your tinnitus? And majority of people answer no to that. So I would say that using sound therapy is perhaps one of the ways that you can regain a sense of control over your tinnitus, because you don't have to listen to it all the time. Another really common problem is that when you have been somewhere noisy and then you go to you come out of that environment and you're suddenly in a much quieter one, that would be a time when you're really aware of your tinnitus. So using sound therapy in those quieter environments can help to reduce the contrast, and that can be really useful. I just thought it'd be quite fun to have a bit of a look at kind of devices that we've maybe used through time. So some of these are before my time, the first two on the top row. So I think that one on the far top left, you know, that's just a really basic white noise generator. I believe you can still buy them. I could see them online. But, you know, I've never actually seen one in the clinic. Same with that other one. From what I could see online, that was something from the 60s, so well before my time. When I started in tinnitus therapy, we did have these basic white noise devices, and that's like this one and this one, and they literally just played a white noise, and you put a battery in and away you go. Then you've got these kind of tabletop devices. So this one is an older one now, but that, you know, was good because it actually had a range of different sounds that you could provide. And then you've got, you know, this is the modern equivalent, and this is a much better sound quality. And of course, now, you know, in the world we're living in now, we've got smart speakers, we've got apps, and we've got digital hearing aids, some of which connect to our smartphones. So we've got all of these possibilities with sound therapy. And for me as an audiologist, it's so pleasing that we've got so many options now, because as I say, when I started, it was very limited. And of course, you know, one of the key times we might want to use sound is when we're trying to sleep, because tinnitus, you know, for many people is really bothersome when they go to bed. You know, that comment I said that I often get earlier from people saying that they can't use sound at nighttime because they would disturb their partner. There are ways around that. You can get these things called sleep phones, you can get pillow speakers. They have wired connections or Bluetooth connections. So there are ways for you to listen comfortably without disturbing your partner at all. We do say at night time it's best to use sounds that aren't too interesting. So if you're listening to a really nice piece of music, or a new audiobook or something, it's going to keep your brain too active. If you want to sleep, you probably need to use more natural sounds, or use something that you're really familiar with, maybe a story that you've heard lots of times. Or people even tell me that they listen to things like the World Service. So it's just, it's finding something that's not too interesting. What I'd also say is it's fine to, you can put it on a timer so that it goes off after a set period of time. But if you're somebody that sleeps very lightly, and you tend, or you wake a lot in the night, then it may be that during those lighter periods of your sleep cycle, a change in your auditory environment could be enough to wake you. So if that's the case, you don't want your auditory environment to change. So therefore, you should just leave the sound on all night, and it's fine to do that. And then it's instantly there if you wake. There are also, there's the option of using a smart speaker in your bedroom as well. And I thought I should mention auto sounds, of course, because in the auto app, there's a really nice selection, and they're divided into different categories. I was talking to a colleague yesterday, actually, about the fact that the underground sound is on there, because she was telling me that she had a patient once who, years ago, who only got relief from his tinnitus when he went on the underground. So he used to spend a lot of time going around the circle line, is what she said. Another thing that kind of blew my mind recently was how many different sounds there are just on Alexa, for example. So you can access these by opening, can't remember if you have to say open sleep sounds or open my sleep toolbox. But once you've done that, you then say, Alexa, list sounds, and she'll go through them. And there are about 125. So you've got, probably 5 or 6 different variations of rain sound. But then you've also got more unusual ones like a grandfather clock and a cat purring. So there's lots and lots of different ones on there. I wanted to say this evening that there's no evidence that any one sound works better than another. So, there's some evidence out there that sound therapy is helpful, but there aren't studies that have, looked specifically at different types of sound. So you should use a sound that you like. There's also no evidence that masking sound is more effective than sound enrichment, although some might say that if you're masking sound all the time, then you can't habituate to your tinnitus, because if you can never hear your tinnitus, how would you habituate to it? There's also no evidence that any one particular device works better than another, or that you should use sound for a particular time period. You should just use the sound when you feel you need to use it. So maybe at quiet times, or just at times when it's really bothering you and you want to do something. You also don't have to have a sound that's particularly tailored to your tinnitus. That's another thing people sometimes are quite surprised by. People will often say, don't you have to look at what my tinnitus is like? Don't you have to kind of measure the pitch of it or the volume of it? And we don't have to do that. So hearing aids then. So how do hearing aids help with tinnitus? Well, one of the guys that's done a lot of work in this area is Grant Searchfield, and he's a bit of a hero of mine, because he's produced really great guidance for audiologists, lots of research papers. And what he says is that when clinicians are fitting hearing aids for people with tinnitus, essentially what we're trying to do is to improve the audibility of one set of sounds, whilst at the same time reducing the audibility of another sound or set of sounds. And I think he illustrates this perfectly with these pictures. So here we can see a bug. I don't know what it is, maybe a grasshopper. We can see some detail. But we can't really see the image behind it. We could make a guess at what it is, but it's completely blurred. We can't really see that clearly at all. But here, of course, our attention is now drawn to everything else that's going on in this picture. Now, if you want to think about the bug, you could still focus your attention on it, but actually there's so much more to look at now, so much more to grab your attention. So I think that's a really great analogy. And there are so many reasons why hearing aids are helpful. Apart from anything else, if you do have hearing loss and you've not had hearing aids before, what might have happened is that you might have lost some confidence with your hearing. You might have become a bit anxious about going into certain environments where there's lots of noise or lots of people. So if suddenly you can hear better in those places, then it can really help to improve that. If you've got hearing loss, you are probably having to put a lot of effort into listening. You're having to actively concentrate on listening, and it's tiring. And of course, then you get tired, you get more irritated, and then your tinnitus is worse. So often people will say to me that it's when they've been in a social situation and then they get home, that's when their tinnitus is raging. So if we can reduce listening effort, then we might be able to stop that from happening quite so much. It's also not until you try a hearing aid sometimes that you realise how much you've lost and how hard you have been working to listen. So sometimes it can really help you to understand just the significant impact that your hearing loss has had. And of course, if you're more aware of background sounds around you, then hopefully you're going to be less aware of your tinnitus as well. From my perspective as well, I think another great thing about hearing aids is when people decide to go for a hearing aid, we get to spend a lot more time together setting up the hearing aid. And then, you'll come back to clinic and we'll talk about how you're getting on. And we can also spend that time talking about your tinnitus. So it just provides further opportunities for sort of tinnitus counselling. There's also these things called combination devices, which offer some sound therapy as well as amplification, which I will talk about. I'm not going to go through all these because I'm conscious of the time, and I delayed things by being a bit late getting started. But of course, when you are considering having a hearing aid, there are so many other things that we have to think about, and a good hearing aid assessment will cover all of these things. So we'd be wanting to find out just how motivated you feel, because if it's a mild hearing loss and you're not really noticing a lot of difficulty, you just might not feel ready for a hearing aid, and that's okay. Hearing aids can be tricky to get used to, so you've got to be ready for it. Also depends a bit on your lifestyle, because if you're a builder and you're working in noisy environments all the time and you're needing to use hearing protection, which is really important to make sure your hearing and your tinnitus don't get worse, then there are going to be large periods of time during the day when you can't wear hearing aids. But equally, if you work in a very quiet environment like a library, well, then amplification isn't going to do much for you because there's not an awful lot of sound to listen to. So these are all things that we have to think about. And we also have to think about not just how well you detect sounds with a hearing test, but how clearly you can hear sound. What's your speech discrimination like? Is your tinnitus in one ear or both? What about the hearing loss? So there are all of these considerations. And when you come for an audiology appointment, we should be talking about all of these things. So combination devices are hearing aids that have like a built-in sound generator circuit, and they only offer sort of quite limited broadband sounds. So that would be like a white noise or a pink noise. Some of them also offer what they call nature sounds, such as ocean sounds, but I would say they are quite similar to white noise. It's just that they're kind of coming up and down. So the sound will crescendo and then it'll get quieter again. And these sounds can be set on a separate hearing aid program, or they can be combined with the amplification. So you can have the hearing aid working as a hearing aid, but just with a gentle sound in the background. And if you are somebody that works in a very quiet environment like a library, that might be a really good option for you. So, if you're wondering, well, would a combination device be suitable for me? If you have a bit of hearing loss and you want to try it, then absolutely yes. We follow professional guidance that tells us these are all the circumstances in which we should consider it. So for people who want to try it, yes. For people who are only going to get limited benefit from amplification, yes. And also, you know, I would say for people who have found benefit from using ambient sound or other forms of sound therapy, we also get some people who need amplification, but they don't want it all the time. Like there might be times when you just want to break from it, but actually then just having gentle sound in your ear can be really helpful. Again, you know, some practical things to consider. I would say that, you know, if you are not going to access, like so some hearing aids, you can access an app on your smartphone to control it. If you're not going to do that, you do need to have pretty good dexterity to be able to operate like the button on a hearing aid and things like that. There's also this feature which is automatic level steering, and what that means is that if you go into a quiet environment, the sound generator will automatically kick in. So the hearing aid will recognize you've gone somewhere quiet, maybe you need a bit more sound for your tinnitus, and so it will automatically increase that. Now, a handful of times I have thought that might be appropriate, or someone has actually asked me for it, but other times I think it's perhaps not a good idea, because maybe you don't want a reminder that you've got tinnitus. And you know, the volume of your sound generator going up might be exactly that. I think also if you're thinking about perhaps more elderly people, and particularly anybody with cognitive decline, so anybody with the start of Alzheimer's or dementia, this might not be an appropriate thing for them to have, because they might not be able to make an appropriate choice about when to use sound and when to use amplification. If you've got quite a significant hearing loss, then it might be that actually, you know, you really just need the amplification, and the sound is a barrier to hearing well. It also depends, you know, if you've tried white noise before and you really didn't like it, but maybe you liked other sounds, then that you're probably not going to benefit from a combination device. And actually what might be better for you is if you can use a hearing aid that you can connect via Bluetooth to your smartphone, and then you can use apps instead. So again, you know, like the Auto app, or you know, there are others as well, that provide a whole range of different sounds. And again, you know, this is one of the wonderful things I think to happen in the last few years for me as an audiologist, that now we can give people hearing aids that connect to their phones, and so you can stream any sound you like. You're not limited to what's built into the hearing aid, or you know, to what comes out of the machine. You can even create your own soundscape. So that might mean that maybe you mix one sound with another one or another two. So I think the possibilities available to us now are absolutely fantastic. So I think, you know, for me today, my take-home messages to you would be that I believe sound therapy is actually a very helpful additional thing to have in your tinnitus toolbox. Sound therapy should be enjoyable. If you haven't found a sound that you like, maybe you haven't looked hard enough. I've mentioned apps, but there's also YouTube. You can pretty much get anything you like on YouTube. And in fact, I had a young teenage lad who absolutely felt at his happiest when he was mowing the lawn, which he did to earn some money. And he would go to bed at night with lawnmower sounds running continuously from YouTube. There are different ways to use sound, so just consider what is it that we're trying to achieve. If you're worried about practical issues, usually they can be overcome, I think. But if you have any degree of hearing loss, then do think about a hearing aid, but make sure that you're having that conversation with an audiologist who really understands tinnitus and has some experience. So that was the end of my slides, Ed. So I'm happy
Rachel,
to take questions.
Thank you. That was so helpful. You know, as I said before, I learned a lot there, and there's some really useful insight about sound therapy, and I think has covered many of the questions that we get quite regularly about sound therapy. There's some really common things that people like answers to, and I think that's covered a lot. So let's jump straight into the questions. So we've got a question here from Steve. So Steve's asking about notch therapy. Does notch therapy work for tinnitus, and should he look for a hearing aid with that feature?
So there's no no really robust evidence to say that notch therapy works. It's certainly not something we practice in our clinic. You know, there may have been some studies that have shown some short-term benefit with it, but not long-term.
Okay, good. And so Dave's asked a question here about how long it would take to see the benefits in tinnitus after starting to use hearing aids. So Dave's been using hearing aids for about 3 months. How long usually is it before you start to see results?
It's really variable. It's such a difficult question to answer. You know, I have definitely had patients who I've fitted the hearing aids and they've had noticed an instant difference in clinic. But there are so many things that it's dependent upon. And you know, it depends on your degree of hearing loss. It depends what your speech discrimination is like, how much benefit you're getting from the hearing aids, how motivated you are to use them. So it's a really difficult question to answer. On the whole, I would expect that within you know, within 6 months, you should be noticing a difference. But if you're not, or even worse, if the hearing aids seem to be making your tinnitus worse, there's a problem there. Something hasn't quite been set up right. So do go back to your audiologist.
Yeah, and I think Dave has put in the chat as well. Unfortunately, it sounds like he didn't have a great experience with the audiology department. They didn't do any setup with regards to tinnitus. So Dave, definitely worth going back to speak to them.
Go back and ask them, you know, ask if they have anybody there that's really experienced with tinnitus that he could see, would be my advice.
Yeah, unfortunately, it's just something that we see far too often with tinnitus. That people just unfortunately have not great experiences because of the lack of training. It's the same with doctors as well, with GPs. I'm sure you've tried to do some work trying to educate GPs and even ENT surgeons as well. But we hear it a lot, unfortunately.
So I had an ENT doctor once said to me, he said, "Oh, what do you do with tinnitus patients?" And I said, "Well, we have a session that lasts at least an hour. You know, we do lots and lots of work with them." He said, "What on earth do you talk about for an hour?" I think that's the difficulty. We've got a long way to go.
We do. But you know, everyone listening here, it's clear that if you've been told by your doctor or an ENT or anyone that you can't do anything for tinnitus, there's nothing that can be done for tinnitus, you know, that's so wrong. There's so much we can do for tinnitus. Yeah, you know, Rachel's just talked in depth about lots of different things we can do with sound therapy and hearing aids. So, you know, don't be disheartened. So Rachel, question here from Steve. How long does it take for sound therapy to help with tinnitus? I suppose that's kind of similar to the previous one, but maybe more specific to sound therapy.
Again, it depends how you're using it and what you're trying to achieve. You know, obviously, if you're masking your tinnitus, you might get some instant relief, but then probably as soon as you take the sound away, you're going to notice your tinnitus again. If you're using it more like sound enrichment, it's going to take longer. It will, you know, take a much longer period of time. And it's really hard to measure how long that's going to be. It could be weeks, it could be months. You know, generally, I would say, you know, within 6 months, things should be starting to get better.
Yeah. I suppose it's a very difficult question, isn't it? It's like, how long will habituation take? It's very variable, isn't it, from person to person?
And of course, you know, yeah, absolutely. And if, you know, when we do a tinnitus assessment, because that's, you know, I've really focused on one aspect of therapy, but before we get to that, we do a really detailed assessment and we look at all of the different things that are contributing to your experience of tinnitus, why you have it, why it's become bothersome for you. And as an example, you know, if you're really suffering with anxiety, it's probably going to take a lot longer, and nothing is going to be very effective until you've also dealt with the anxiety. So we'd be making recommendations for that as well.
Great. Okay. Really good question here from Jill. Will hearing aids help or hinder hyperacusis that comes with tinnitus?
That is a good question. It's a very difficult one to answer because hyperacusis is actually such a broad term. You know, it's kind of an umbrella term. There are many, many different types of sound sensitivity. So it kind of depends a bit on what's driving your sound sensitivity, why you have it. Rather like tinnitus, you know, there could be a number of different reasons. But on the whole, if you have got hearing loss and hyperacusis, we would expect that having hearing aids would help with that, as well as with the tinnitus. Sorry,
Great.
as well as with the hyperacusis.
The hyperacusis, yeah, of course. No. Okay, so coming up to the end, so I'm going to get through. We'll see if we can do a few quick fire questions. So Giselle's question: is the sound as different from one ear to the other and from one day to the other? So if the tinnitus is varying, do you need to make adjustments to the hearing aids? How would that work?
You just would need to have a good volume control and to have the volume control independent for each ear. So you can do that. If you've got a different sound in each ear and it's, as you say, if it's varying on each side, it might be that one day you need to tweak the left one up or turn the right one down. So you just need to make sure you've got good user controls to be able to do that.
Great. Okay. Very quick question here from Mark. Does hearing aid increase the buildup of wax?
Yeah. Well, it can do because your ear is, it depends a bit on what type of fitting you've got, but as generally, if you've got something that's blocking your ear up all the time, that's preventing the natural passage of wax out of your ear. So yes, you might be more likely to build that wax.
Yeah. Guys, if you do have wax in your ears, don't stick anything in your ears, please. Please, please, please.
Have it removed professionally.
Exactly. Go to speak to an audiologist. So question here from Rob. So if you wear hearing aids in the long term, can it make hearing without a hearing aid worse? So I think what he's asking is, once he started wearing hearing aids, he kind of stuck wearing hearing aids for the rest of your life, or could you go back to not wearing hearing aids if your hearing loss is only mild?
Yeah, so you could, it's not going to damage your hearing. So your underlying hearing will still be the same, but of course your perception of sound will be different. You get used to that sort of slightly louder level of listening. So then when you've been wearing them for a while, if you remove the hearing aids, to begin with, it might seem a much quieter world than it was before, but you would get used to it again. So, you know, if you really wanted to just stop using the hearing aids for a while, you would get back to where you were.
Got it. Okay. Question here from John. So John's had a very high frequency hearing loss for a while. Is a hearing aid a good option for high frequency hearing loss?
Well, again, it's so difficult. There are so many things we would have to look at and consider. It depends really on the extent of damage to the cochlea at those high frequencies, because if you've sustained an awful lot of cell damage, you might have something called dead regions, which is just areas of the cochlea where none of the cells are functioning as they should be. In that case, if you try and amplify that high frequency region, it's probably not going to do a lot. But, you know, there are things that we can do within the programming of the hearing aid to help with that. So, you know, just talk to your audiologist.
Yeah. Thanks, Rachel. And I would just probably say as well that I'm sorry if we can't give specific medical advice here, guys. If you've got a very specific question, we can give general advice, but it's definitely worth speaking to your audiologist about those. There was a really good question here. Oh, Steve, can you wear hearing aid to sleep?
We don't advise it. The reason being that it's good to give your ears a break from the hearing aids at night time so that they're not occluded with the earpiece. Some of the earpieces that we fit are like a very delicate little rubber dome in your ear, and actually it could damage the hearing aid or hurt your ear to sleep in it. So that's why we talk about other sound therapy solutions to use over at night time.
Got it. Okay. Rachel, we're going to ask one more question, then we're going to close up. So question here from Steve. Does the cost of the hearing aid matter for tinnitus?
No, is the short answer. So any hearing aid, in fact, what I would say is it's not about the device, it's about how well it's fitted. So I work both privately and in the NHS, and there's not a huge difference between the technology that we fit. It is all about how it's fitted.
Great. Okay, Rachel. If someone is in the UK and if someone would like to see you privately, how would they go about that? Is that possible, or would they need to get a referral from their GP?
It is possible. So we have myself and my colleagues. We have a website. We've got details. We can provide that. Absolutely.
Great. So, guys, if you Google Rachel's name, Rachel Knappett, you'll be able to find her details, and you can get in touch if you'd be interested in seeing her. But otherwise, Rachel, I just want to say thank you very much for joining. I'm sorry about the technical issues. That was a fascinating
I'm sorry, it's probably
presentation.
my fault.
No, these things always happen with Zoom. But yeah, that was a fascinating presentation. I learned a lot. I'm sure everyone here learns a lot as well. So thank you very much for joining. And maybe in a few months we could maybe if you're a bit quieter, we could do another one.
Yeah, be a pleasure.
Thanks so much, guys. You take care.
Thank you.
Thank you. Bye.
Bye.